This video shows a patient having their oxygen saturation, blood pressure and heart rate measured as part of their pre-assessment for sedation. The oxygen saturation sensor is placed on a finger. The blood pressure cuff is secured to an arm. Please note the pre-assessment record in the top left-hand corner of the screen, on the reverse of which is guidance on filling out the form. The results show blood pressure 120/56, heart rate 53, oxygen saturation 99%. Now we are looking at venous access. The clinician is using their hand as a temporary tourniquet and the patient's hand is being held below the level of the heart. This makes the veins easier to palpate and visualise. By wiggling the patient's finger, you might identify veins that are either fixed, which is a good thing, or mobile, which makes them more tricky to cannulate. Looking for valves may also identify veins that are more challenging to cannulate. The veins on the dorsum of the patient's hand will be described as good. We also look at veins in the anticuticle fossa. These veins are usually easier to palpate than visualise. In this case, they are both. Again, these veins would be described as good. Some veins are less easy to visualise because of subcutaneous fat, but the principle still applies, using a tourniquet and holding the hand below the level of the heart. The clinician is able to identify veins that would be good to cannulate using these principles. Here the patient has a houseman's friend, which is often an easy to visualise and palpate vein. Again, looking at the anticuticle fossa, these veins are sometimes easier to palpate than visualise. Looking at both arms and both hands is important. Here they have identified an upside down Y. Using this vein might be advantageous as it is more naturally fixed, making cannulation more straightforward. Again, this vein would be described as good. Here the clinician is tapping the veins, which can also help make them more prominent to palpate and visualise, but is somewhat painful.